Good afternoon. Welcome, everyone. It's my pleasure to introduce you to the next in a series of webinars from SSTI called Measuring Accessibility. This installation is called National Evaluation Local Application. My name is Michael Brennis, and I am a researcher with SSTI, the State Smart Transportation Initiative. We are going to kick things off with a little interactive feature, a poll. If you would let us know this poll is looking at what professions our attendees are in. And while you're filling out the poll, I'll just read through a couple of housekeeping items. The webinar today is being recorded and will be released on the SSTI website, ssti.us, after it's finished. And we will have a question and answer feature at the end of our presentations. If you would type your questions into the Q&A box, we'll get to as many as time allows once we've heard from all of our presenters. There are the results of the poll. Looks like a lot of planners and folks in state and local government. A few academics, some students, advocates, and others. Great. The State Smart Transportation Initiative is a joint project of UW-Madison, University of Wisconsin-Madison, and Smart North America. We focus on promoting sustainable, equitable transportation practices and assisting agencies in advancing such programs while maintaining governmental efficiency and transparency. We do this in three ways. First, we are a community of practice where state DOT leaders can share challenges and best practices with leaders from other states. We have an annual meeting. We conduct research and offer technical assistance to agencies interested in what we can provide. And we share knowledge, as we're doing today with this webinar. We also publish a blog and a newsletter examining applications of current research, trends in travel behavior, and other transportation and land use issues that our audience may find interesting. You can sign up for that newsletter at ssti.us. And if you wouldn't mind, please take the survey that will be distributed after the webinar. I'm going to leave the definitions of accessibility to our presenters today. We assume that most folks here know something about accessibility, and have some familiarity with accessibility analysis. For those folks who are wishing to explore available tools and techniques, the SSTI Measuring Accessibility Guidebook that's available on our website may be a good launch point. Today, we will be hearing from the folks at the Accessibility Observatory about their interesting work that they're doing in the field of accessibility, including some insights into, spoiler alert, some pandemic-era national metrics. We'll also hear from someone involved in putting accessibility analysis and metrics into practice at the state DOT level. Let me introduce our speakers. First, we have Eric Lund, who is the director of the Accessibility Observatory at the Center for Transportation Studies at the University of Minnesota. He provides leadership, direction, and strategic management to the observatory and oversees its research and outreach activities. He has a background in quantitative research and earned his PhD in behavior, ecology, evolution, and systematics from the University of Maryland. Soumya Jain is a transportation planning and policy researcher for the Accessibility Observatory, who works with geospatial and data analytics tools to address transportation access and equity concerns in decision-making, working closely with state departments of transportation and local transportation agencies. Soumya is a Master of Urban Planning alum from the University of Illinois at Urbana-Champaign. I always say Champaign-Urbana, sorry. And Meredith Hill is a transportation planner and asset management program deputy director, delivering data-driven approaches to performance, asset, and risk management for the Maryland Department of Transportation State Highway Administration. In a previous role as division chief of innovative planning and performance, she directed the resiliency program and freight safety and mobility planning, and planning for all critical assets and climate risk. She earned a master's degree in regional planning from the University of Massachusetts Amherst and Meredith wins today's prize for exceptional headshot. And with that, I will turn it over to our speakers.
Great. Thank you. And thanks everybody for being here. And I really want to say thank you to SSTI for sharing this time with us and giving us the opportunity to share the work that we're really excited about at the Accessibility Observatory. I'm going to give a brief outline of what we're going to walk through today. We're going to start with, yes, a little background on accessibility. Certainly most people may be familiar with the concept, but it never hurts to be specific, especially when we're talking about big data sets that we're going to be going through the rest of the time. I want to make sure we're all on the same page of what they mean and how they're calculated. We're going to walk through our National Accessibility Evaluation, which is our big scan of the national picture, and the reports it produces, which we call Access Across America. Then we're going to hear from Meredith in Maryland about some of how they're using those data in their local work, as well as a regional project, which we're very excited about in the Appalachian region. And we'll close with some words on the data we're producing and hopefully have time for some questions and answers. So to be clear about accessibility, I often say access to opportunity. There are many synonyms for this. Of course, this word accessibility has other synonyms in transportation. So we want to be clear from the beginning when we talk about accessibility, we're talking about the ease with which a traveler could reach valued destinations. This definition highlights a couple things that I want to dwell on. The first is we're measuring some kind of ease or cost, inverse of cost. If you think about how long it takes to get somewhere or how much it might actually cost in monetary value. The second thing is we're enumerating potential destinations. These are not measurements of actual travel behavior from origin to destination, but actually trying to say for a given origin, what are the possibilities? What are the opportunities? And that's really fundamental to what we're reporting on today. It's a measure of opportunity, not of necessarily behavior that's taken. The classic example would be to describe or count how many jobs one can reach leaving, let's say, their home and driving for 30 minutes in a car at 8 a.m. on a weekday. So this description of the map we're looking at here contains a few of those components of accessibility, the metric itself. And in order to do these calculations and come up with these summaries, we have to have these components. So we need to have starting place. In other words, where is your origin? We can think about it as the origin of lots of people, depending on how many people are living in a given place. We're going to be counting some kind of opportunity. So maybe it's the number of jobs, maybe it's the number of healthcare facilities, maybe it's the closest healthcare facility. Okay? Something about the opportunities that you want to quantify. And we need a travel network. So for someone to leave the origin and arrive at the destination, what are the pathways they're going to take or could take, depending on their particular mode? And as will become clear as we go through the data, when this travel is happening is very important to the accessibility of it. And we usually measure that ease of finding that connection between origin and desired destination to be time, something that everybody is well practiced at valuing. So to provide a little bit more detail about the calculations that are done, actually before I introduce the observatory in our project, okay, I will show you how we typically build these data sets. And what we do is essentially data science, or in some cases, building software in order to build data sets that then we use for understanding. So we're combining lots of these inputs. We take data on road networks and auto speeds along those networks, transit schedules, information about bike lanes and pedestrian paths and open street maps. We have a lot of data from the census about where things are located, including the jobs data that they put out on a very fine scale. So we collect all of this input data that's necessary to do the calculations. The second step is a little bit of the more software engineering piece, which is building a tool to let us take someone from an origin to all of the possible destinations. And there are some really good open source tools, a couple of them listed here, to help us do that. And we've done a lot of work to integrate all these source data into these tools to build these data sets. But essentially, this is the step where we take someone from the origin and enumerate the places they could get to in a certain amount of time. And once we do that, we can find out what can they reach. So if you can travel a certain area in 30 minutes, what do you encounter in that potential travel? And that's where we start doing the math of actually adding up or otherwise calculating the opportunities. There are some complications, of course, like this differs by time of day. So we always want to know how the time of day matters for travel, things like auto congestion. When you're talking about transit trips, the actual minute that you depart might matter a lot for how fast you can travel on the transit network, because it means you might either just catch or just miss a bus coming by. We do multiple evaluations of bike networks based on their level of traffic stress, which I'll go into later. And then we have millions and billions of rows of data when we're doing this across the country. And so to actually make these data sort of useful, we have to start aggregating, weighting back up again, and doing some synthesis and reporting, which is what we're going to talk about today. It's largely the reports that are coming out of this whole process. But so we have this data pipeline. This data pipeline exists only because of the people, mostly not me, who are at the Accessibility Observatory. So AO, as we sometimes call it, is a research unit inside the Center for Transportation Studies here at the University of Minnesota. Andrew Owen, our lead researcher, has been doing a lot of this pioneering work in the software and data development to put these things together on the scale that we work on them with. You'll hear from Soumya in a minute about her work in the Appalachian context, and then Shirley is the other researcher we have on our team doing a lot of good work in this data development area. Okay. So what I'm going to talk about today is our largest project, which is called the National Accessibility Evaluation. So this is the national part of the title of this webinar, and we'll get to the local in a minute. This project is a pooled fund project, which means it is a collaboration between the Federal Highway Administration and various state departments of transportation. And there have been different collections over time. Right now, we're funded by a group of 12. You see on the map here. This is the 8th reporting year of this project and the second phase. So the pooled fund itself had a 5-year run and is in the middle of its second 5-year run. And that shows, I think, the value of creating these data and sharing these data, because it was something that people wanted to keep going. The data we produce and the reports we produce are used, as you'll hear, for performance management, project prioritization, and lots of other planning functions. Okay. But the idea behind this national evaluation was to provide a uniform data set across the country that we could look at in space and in time. So the key contribution, I think, of the Accessibility Observatory in this work is providing that trackable, comparable data. So it's uniform across space and you can look at it over time. So across space, this is what it looks like. In 2021, we calculated the number of jobs one could reach from each census block in the United States, 11 million of them. And this map is showing how they get aggregated up to the continental map here. So there are a couple of things to point out about this. So the axis itself, I should say, runs from sort of light blue as the lowest to bright red and purple as the highest level of access to jobs. So really what it's highlighting first is that there's a pretty big difference between rural and urban job accessibility, or job accessibility is very clustered in urban areas. And that's true. But as we'll hear also, it's important to know that the accessibility concept in math still applies in rural contexts, and those blocks are still included in the data that we calculate. The other thing you're going to notice is that there are a couple of states with more or less blank results in this map, Arkansas and Mississippi here. Also Alaska, this applies to, that they did not contribute their kind of fine scale jobs data to the national census data product that we use to calculate job accessibility. Okay? So this does highlight sort of a limit of those data sets that we were discussing originally. And because we want to have uniform data across the country, we rely on these national data products. And where those national data products have gaps, we too have gaps. So I just wanted to point that out. But because, again, looking at this, that accessibility is really an urban phenomenon at the broad scale and national reporting, that is where we focus our kind of top level summary reports, okay? We call those reports Access Across America. And we develop these reports for access by transit, by auto, by bike. And we highlight the top 50 urban areas by population. So these are the brightest red spots you see on the map. And we look at each of them in ways that we'll show you. But we look at the summary of their access, the weighted average access across the region, how that compares with other peer cities. And again, because we have this consistency in our data generation, we can look at change year over year and make some conclusions about the trends that are going on. Okay, so to highlight our most recent Access Across America reporting, I'm going to start with the transit report. And these are some example maps of the urban areas that are highlighted in the transit access report. So New York, San Francisco, Chicago on the top row, Los Angeles, Boston, Washington, D.C. These are the top 6 by average job accessibility transit regions in the country. And you can also see, again, we use this comparable scale. So these access data are all on the same scale. So when you're comparing city to city, looking at the heat map colors, the red in Chicago is the same as the red in Boston. And you can kind of see the difference in the geographic spread of that high level of access, for instance. And New York City is certainly on its own scale, as it is in many things. Okay. So we provide these scale maps for the top 50 urban areas in the US. We also provide these summary data, such as kind of the rank in accessibility and some other information that we use, like the total jobs and job density. In this case, for Seattle, you can kind of use that total jobs number and compare it to the jobs that are accessible in a 60-minute travel time using that curve below. So in Seattle, the average worker can travel, if they travel 60 minutes on transit, they can reach, on average, about 200,000 jobs. That's around 10% of the total jobs in the region. So these sorts of short, stats are very useful for people summarizing different aspects of accessibility via transit. This curve also shows that, again, the amount of time you're spending traveling impacts your accessibility. And one of the more interesting things I think that's in these reports is looking at how the rankings kind of change as you look at those different travel times. So I won't dwell on this overly, but looking at where cities like Chicago have a very high accessibility in the closest travel times, but kind of are lower in the longer travel times, maybe Los Angeles, vice versa. It tells you something about the distribution of jobs and the transit system itself. Okay. So these are the kinds of things that we've been reporting in Access Across America over years over years. But one of the things I want to focus on is that 2021 is not really like any other year that we've calculated access for. And in fact, it was a very special year for travel behavior, as I think we all know. This graph shows the ridership, that is the use of the transit system, national average, starting on the left side here in the beginning of 2020, and then plummeting in March 2020 when the COVID pandemic took hold and changed travel behavior across the country. So the time we're reporting on right now in this 2021 area, the ridership nationally was around 40 to 60, about 50% of what it had been prior to the pandemic. Okay. This is something that's been really widely reported, and I don't think is news to anyone on this call. But what I want to do is emphasize that this trend is about use of transit, ridership of transit, actual trips taken. And the question that we are able to answer with these accessibility analyses is, what about the opportunities? How did the opportunities change during this time? Was the accessibility the driver of this? In other words, did the transit system reduce in access and therefore there was a lot less ridership? This is important because there were a lot of people on board transit during this time period in 2021, early 2021. 50% of the riders or trips may have been gone. That doesn't mean that there weren't a lot of trips being taken. And in fact, people using transit were most often meeting their own daily needs, in a lot of cases supporting the daily needs of people who weren't moving around a lot, right? So that designation of its essential worker was something that transit agencies really embraced and thought about, the value of the service supporting the function of these cities, even when ridership was very low. So the accessibility question, like what can you do with the transit system, still mattered a lot during this time. And what we found was that unlike ridership, accessibility did not drop during COVID. In fact, we saw small to moderate increases in transit access in the majority of the urban areas during this time period. And there were only a handful of cities that had what you might call significant reductions in transit access. Okay. And this is really, in some ways, surprising, but it's important to emphasize that what we're talking about is quantifying the opportunities available, so not their use, right? We know use declined, but as infrastructure for people moving around their cities, transit accessibility actually was very stable during this time period. Some other research we're developing is looking at kind of how this happened. What are the areas inside these urban areas that maintained versus maybe lost a little bit of access? For instance, we're finding in many places the core urban areas were maintained in their access, and the kind of suburban areas, which were more focused on those office commuter trips, were reduced in their access, which only sort of makes sense. We also are looking at things like the household income of the areas and their access over time, and finding that in many systems, the lowest income neighborhoods had the highest access and the highest maintenance of access during this time. So there are a lot of reasons why this would be, but I think what it overall shows, again, is that transit access did not change very much during COVID, especially for those who were using the system. So why not? Well, the answer is because the federal government decided that access should be maintained. And there was an enormous allocation in the CARES Act, one of those early COVID response bills, to make sure that transit access, although that's not how they described it, maintained during this time period. Okay? And this was the lifeline for transit, and certainly is the reason why we did not see a giant decrease in accessibility, the same way we saw a giant decrease in transit ridership. Okay? But the tail end of this story is not yet complete. And in fact, we're now moving into a different situation where, as the CARES Act money is expiring, the ridership now is coming back into the equation. Because where ridership essentially is revenue for transit agencies, and that's different for many different agencies, there may yet be reductions in access coming as agencies try to balance this fiscal picture. And that, I think, is what a lot of people are worried about when they're looking at ridership. But just to conclude with the headline that it wasn't something that drove ridership decline. Ridership decline happened independent of what people could do with the transit system during this time period. Okay. So now I want to move on to auto and talk about what we found in our scan of access across America using driving as a mode. First, I just want to emphasize we use some very detailed data on observed speed that we purchased in partnership with our DOTs from TomTom. So we have speeds on road segments down to the 15-minute time periods and below by different days of the week. Okay. So what that means is that when we're doing our routing of leaving from an origin, heading out to all the potential destinations, during that trip, you might be driving partially in free flow and partially in a more congested condition. We have the data to be able to accurately reflect that in how far we observe people traveling and therefore their access. This also points out one of the key messages here today, which is that how you travel, how other people travel, actually feeds back on accessibility in the auto mode. So I'll explain that a little bit more. A little context setting, in this case, in 2021, driving behavior changed almost as much as transit ridership. It changed in a little bit subtler way. Right now, we're looking at a graph of the time of day across the horizontal axis, and either the expected in black or the observed in blue traffic at a certain time period. Okay, and because we have historically calculated access by all modes at 8 a.m. as part of the peak travel period in the morning, it's important to point out that during 2021, and this was a pattern, these data are from a local source of MnDOT, but actually this was a very common national pattern. The AM peak was much below the prior expected or pre-COVID almost everywhere. And even where the afternoon peaks were closer to expected, the AM peaks were much lower, largely because the AM peak jobs were more connected, or sorry, AM peak travel was more connected to these sort of office commute jobs, which weren't happening, okay? So as a result, when we started doing our calculations, we found that auto accessibility was hugely increased. So from 2020, you see on the left, the Boston region, there is a very small area in bright red where people leaving from those origins at 8 a.m. on a weekday could reach most of the jobs in the region in half an hour, but there weren't very many other places where you could say that about. Whereas in 2021, during our study period, there's a huge swath of the region where you could leave a place in that dark red area and reach most of the jobs in the region. So access exploded across that region. The same thing was true pretty much everywhere we looked. There's an example from Florida, one of our other partner states, in Orlando. And even in Los Angeles, and actually especially in Los Angeles, the accessibility by auto was hugely increased in 2021. So on the left, again, there are some swaths of purple where in 2020, pre-COVID times, you could leave home and reach most of the destinations, but those areas are very small. Pretty much everyone in the Los Angeles region in 2021 could reach that many jobs by driving for half an hour. Okay, so just summarizing this, we could go map after map, but really we saw auto access increase in every of the top 50 urban areas we looked at. We saw huge increases, 50% or more access gains in the same travel time in 17 cities. And in Los Angeles, which I just showed you, and then also in San Francisco, we actually saw a doubling of average access by auto from 2020 to 2021. Okay. So I summarize this as congestion has been solved in our lifetime, okay, without infrastructure. We now have free flow access during the AM peak. Okay. I can hear you saying, but so what, because it doesn't matter because no one was traveling to those jobs, right? And that's true to some extent, but actually kind of who was traveling, again, becomes really important. So from this census graph here on travel behavior, you can see that the percentage of people teleworking who make over $100,000 a year was very high, well over 50%. But for people who, again, were more likely to travel to jobs where they were required to be in person and lower wage jobs, there actually was a lot less teleworking, and therefore the access benefit that's out there was being realized by people. Okay? Now, I don't want to say that this accessibility change, if I go back a slide, was necessarily 100% positive. We've heard a lot about speeds, about increases in pedestrian and bicyclist deaths from road crashes with cars. We've heard a lot about potentially negative side effects. But when it comes to measuring the opportunities that people have on the auto network itself, this change in travel and change in congestion really benefited a lot of people and changed the situation a lot. So the question is really then what we call this reduced drivership, which parallels reduced ridership. It's reduced use of the driving network. Can this be sustained? Can we keep congestion solved without infrastructure, right? Well, maybe not if we don't do anything about it, because reverting, and in some cases, tipping the other way might be an outcome of this increased access. In other words, the attractiveness of those maps in terms of the ability to reach so many destinations attract more users than actually can be supported by that access in the first place, which is the typical pattern of car traffic, right? So this is an article from Washington Post a couple of weeks ago, where they looked at observed behavior, so not access, but observed travel, finding that in some cases, there were more people using the road network at certain times than there were in 2019. Okay. So the important thing from the auto perspective is, yes, congestion was solved through travel behavior alone. The challenge, of course, is how do we continue that progress in one sense of turning that accessibility into a long-term use for people. So with that, I'm going to turn to the last mode that we calculate and just sort of emphasize that for biking, there are additional intersections with infrastructure, if you forgive the pun. The way that the biking infrastructure is constructed has a lot to do with what you can reach, because people will not even try to take certain opportunities without supportive infrastructure. So what we do is we grade both road segments and intersections on their level of traffic stress, which is a methodology for kind of categorizing these types of situations. And on the right here, you see, paths that are separated, protected, are likely to be used by almost everybody. And then on the far left, you have the other end of the spectrum where car lanes, without any additional even markings, are likely to be biked in by a few people, but not everybody. And so across the spectrum, you really get an impact of access, depending on what types of infrastructure are available to people. Now, unlike transit and auto, there really weren't strong feedbacks from COVID itself in thinking about access. And so 2021, the changes were modest and kind of in line with other annual changes we've seen. But from other external evidence, we know that the use of biking, and again, so we're quantifying opportunities, but the use of those opportunities did increase during COVID. So there's a lot of interest in how that sort of use can be continued in the same travel behavior incentive way. And one of the ways is by understanding the interaction between the infrastructure and the things you can reach. Okay. So for access across America, transit, auto, for bike, we've generated these reports and a lot of data. I think a fair question, and one that we are always asking ourselves, is how do our DOT partners who are really sponsoring this work use the data? How do these conclusions get put into practice inside the DOT? I will say we provide our partners with very detailed reports about their jurisdiction, not just the block level data, but they get all of that, but also summarizing to these different useful organizations, the MPOs in the area, different census geographies, the counties, whatever might make sense. And of course, they can look at change over time in these areas as well. And as they talk with their local planners and counties and MPOs, they can look at their performance using this consistent data set. We know some of our partners, like MnDOT, our primary sponsor, and of course, if you've been a faithful participant in the SSTI webinars, you've heard from MnDOT about how they are using accessibility in a number of different ways. But one of the things that I think is important is accessibility is written into their annual transportation performance report, the system performance report. So this measurement is being tracked as an evaluation of the entire transportation network, which is great because it's an integrated measure. It is an integrated measure of land use and transportation together. Another sponsor, Massachusetts, MassDOT, has taken our data and made them really interactive and put them in combination with some of their local transportation improvement project data to really show how the access gaps might exist and be fixed by those projects, or maybe places where new projects will result in more access. And so that's another cool use of them. So with that, I'm going to actually turn it to an actual partner we have here in Meredith to talk a little bit about how Maryland State Highway views these data and some other ways we're extending our national work in the region of Appalachia.
Hello, everyone. I'm going to start talking while Samia brings up slides, just in the interest of time. I am with the Maryland DOT and our State Highway Administration. However, MDOT has used all of the different data from Accessibility Observatory across our what we call modals. So our transit agency, our bike ped multimodal team at our secretary's office have all embraced this data and used it in a couple of different ways. I'm just going to highlight 3 things for you here today before I turn it over to more cool tech from Samia. So Maryland and SHA specifically is a very strong partner in innovation and research. So we really embrace the pooled fund mechanism to access these types of studies. The Accessibility Observatory's work is of particular interest to me and to Maryland because we're such a small state. We have a lot of cross-border commute sheds. And when you can find a national data methodology that works across boundaries, it's really informative to our processes. And I'll share a little bit more about that in a minute. 2 ways that I want to, we polled the audience before everyone joined. I understand there are some state and local practitioners, hopefully some more have joined. I wanted to share with you what we did with the Accessibility Observatory's bicycle network, bicycle level of traffic stress methodology. We refined it to Maryland, and we applied it to every road in Maryland. And this is just an illustration of the 1 to 5 scale of bicycle level of comfort. And we can really actually make intersection-based decisions on moving the level of traffic stress on a section of the network as a result of this methodology. So I will say that the national methodology, I firmly believe in. When you start applying it to a state or a region or a local corridor, you want to evolve the methodology to exactly what your needs are. My team at our secretary's office, our multimodal team, did that, and as a result, we have this map and we have decision-making power from it. Competitive grants. Those of you who are aware of the USDOT's model of competitive grants for infrastructure are hopefully looking at ways to be competitive in those applications. Quick example, the accessibility data allows you to understand the access from a home census block to areas of interest in different times. Well, if you can imagine a corridor that is heavily impacted by commuter traffic through it, that would have exponential impacts on the residents' accessibility. We were able to use data in a competitive Tiger grant that demonstrated the ability to restore access to points of interest by adding bus-only lanes, by adding bicycle infrastructure to this corridor through a residential area that has impacts of commuter traffic in the AM and peak time. I firmly believe that this data was able to inform that grant. We won the grant, we're still constructing, and we're still measuring and doing the post project analyses to see the change. But those bus-only lanes, the dedicated bike facilities are in place and are definitely seeing improved bus travel time reliability. So that's just two quick examples of how Maryland uses it. Samia, if you could advance to the next slide. We are a member of the Appalachian Regional Commission, which is a representative body for all of the area of Appalachia, which is here highlighted in the map. Appalachian Regional Commission put out, again, a grant opportunity to state DOTs to examine access metrics that could be used for project decision making. I was in a unique opportunity to be able to connect ARC with AO and say, here's a national methodology that already exists that we could apply to this to this Appalachian region, and give you the ability to look at the whole region's access to different destinations. And I'm not going to steal Samia's thunder about the study itself, but again, it's another representation of the importance of the national methodology that can be applied and tailored to different regions. As you can see, well, it's a little small, but there's just a little portion of Maryland's western area that's in the Appalachian region. But we still are a partner with those border states because we do have very large commute sheds across all of Maryland. And so when we are trying to make project decisions, we know that travelers don't stop at a state line. And so we need to know what is upstream and downstream of our project decisions. And this type of national methodology for accessibility of vehicles, of freight, of transit, of multimodal bikes, that's really important to our decision-making process. And so I have so enjoyed the longstanding relationship with the Accessibility Observatory, and I loved the opportunity to make the connection with them to the Appalachian Regional Commission and evolve their study to this type of region. With that, I'm going to pause and invite Samia in. She'll tell you a little bit more about their application to the Appalachian Regional Commission. And I believe there's questions coming in, but we'll address those at the end. Samia.
Thank you so much, Meredith. And of course, the feelings are mutual. So we heard Eric and Meredith discuss the NAE Pool Fund study, and also how we're going to be using various concepts and components of the NAE and develop upon them to fit the Appalachian context. So in this pilot, we are leveraging all our past experiences and adding more destinations alongside the job metrics that we initially established in the NAE. Now, one of the two main components of this pilot is maintaining transparency throughout the process. Now, this is a principle that we strive to uphold even within the NAE. We do that, as Eric walked us through the process, predominantly by working with open source data sets as well as routing engines. The other aspect is to ensure the ease of replicating the process, which was very crucial to the ARC. Now, throughout our work on this project, we have consistently kept these two principles in mind. Now, to the fun part, to job access, we're adding multimodal access to education, healthcare, and entertainment. And when I'm saying multimodal, I mean access by driving, by transit, and by biking. We're also measuring auto access to intermodal freight facilities. Now, as I've mentioned earlier, we are deeply committed to transparency and replicability. And with these principles in mind, we conducted a thorough search for open source data sets that could fit effectively into measuring access to these destination buckets. And all the destinations, all the sub-destinations that you see in here were at national level to maintain consistency across the ARC region. Now, when we're talking about defining metrics, we are measuring access to the nearest for all of these destinations. When I say that, I mean measuring travel time to, say, the nearest trauma care center, measuring travel time to the nearest major sports venue. Now, we're also measuring travel time to the third nearest for a select few. When I say that, I mean we're measuring access to third, which in a way helps us keep choices available for destinations where having multiple options might be critical. Now, you see the Appalachian region on the side. As Meredith already mentioned, it covers almost 13 states. And much like the US, it's vast, exhibits very varying population densities, as well as diverse points of interest. Now, these points of interest are destinations in our case. These disparities can be delineated based on urban or rural nature of a place, or could be examined through a more nuanced lens, say economic distress or vulnerability, something that the ARC often focuses on. Now, our multi-destination, multimodal metrics can contribute to these definitions, facilitating a better understanding of how access is associated with these distinctions. Most access research is usually based on urban context. But with this pilot, we really are interested in seeing how access metrics applies to the rural context as well. Now, the planner in me is super excited about the next few slides. So let's get into a few sample visualizations using results from our pilot and see how it varies in the Appalachian context. So here we're looking at two counties that come under the jurisdiction of ARC. On the left, you see Allegheny County, which is home to Pittsburgh in Pennsylvania. And on the right, you see Randolph County, which is home to Elkin. They're both within the ARC, as I said, and but they both exhibit stark differences. One is primarily urban, while the other is situated in a notably rural, very hilly and stunning, as I heard, region of West Virginia. So our focus here is on bike access to the third nearest high school in both counties. Now, in Allegheny County, which is urban on the left, you can see one can reach 3 high schools within a 60-minute bike ride from most of these blocks. But on the right, we have Randolph County, where maybe due to these limited number of high schools in the area, only a very few blocks can reach 3 high schools within a biking of 60 minutes. Now, I do want to emphasize that this is, as you see right here, using LTS4, which is medium to high stress roads. The access results would significantly change if we were to only measure access that is only allow biking on low stress roads. For example, roads with separated bike lanes or multi-use trails. Now, I like to go back and forth with these maps and see how drastically access changes. We're looking at the same high schools here, but now the mode changes to public transit. The variation here stems from the availability, or you might even say the absence of transit services in the area. Now, even though transit access isn't as high as bike access, there are still blocks in Allegheny County that can reach at least 3 high schools within a transit ride of 60 minutes. Now, on the other side, with Randolph County, nearly no blocks can reach 3 high schools within a 60-minute transit ride. Now, it's worth mentioning that our transit access calculations encompass a walking component as well. They use walking as an egress mode, effectively making this walking plus transit access. So what you see on the right might just be walking access. Maybe there aren't any fixed route transit. Now that gets me to the fact that we're only using, in our transit calculations, we're only using fixed route transit. We're not using paratransit, microtransit. There might be on-demand transit in Elkin, which is Randolph County, but our calculations are not going to show that. Also, I do want to emphasize that with these calculations, we're only measuring the availability of access, availability of services. We don't know how residents are actually using these services. Now let's shift our focus and look at some healthcare destinations. Here we're examining access to urgent care facilities using transit. Again, the travel time is 60 minutes. Now, if you observe the map on the right, only a few blocks, very similar to the last map, can access urgent care within 60 minutes. And they're mostly neighboring blocks. Again, this could just be walking access. In contrast, on the left, access is more evenly distributed, extending to blocks that aren't even near these urgent care facilities. Of course, this does show there aren't as many facilities as one might hope to see in Allegheny County. But if you do look closely, which I really, this was interesting to me, that you can see routes that might actually be serving these urgent care facilities. Now let's change modes and look at how things change when you're driving to an urgent care. This almost seems unfair. We can see what was challenging to reach by transit within a 60-minute transit ride becomes accessible by driving within just 15 minutes. The difference is quite significant, to say the least. Now, sticking to driving, let's switch urgent care facilities to trauma care, which is more where time becomes more critical. So we're looking at a little zoomed out versions of zoomed out maps of both Allegheny County and Randolph County, where we can see the entire county boundary. Now, although the blocks in Allegheny County can access trauma centers all blocks can access trauma centers within 60 minutes, it might take someone 5 times higher to reach the same services. Now, these differences become, as I said, even more critical when time is of the essence, which it often is when one is in need of a trauma center. Now, from both of these maps, we can also notice how the urban Allegheny County is served by almost 5. And I say 5 because I can see blocks darkening here. So maybe a little more than 5 trauma centers. But on the right, Randolph County shares 1 trauma center with a nearby county. Now, ARC or other agencies could use these metrics, for example, to say we want most of the blocks within a 30-minute driving distance to a trauma center. Now, as I said, we just looked at a very few examples of what can be done with these block level access metrics. Once we share these with the ARC, they can employ these metrics to identify gaps in access, identify gaps in services, infrastructure, locate healthcare deserts, education, entertainment deserts, and strategize ways to bridge these gaps through a combination of land use and transportation initiatives. Now we're working on aggregating these blocks, as Eric had already mentioned, these block level metrics to higher census geographies like county level. We're doing that because we measure access at the lowest census scale, which is block, and we can aggregate it to as high as the state. Might not make sense, so we usually stop at counties, but we can do that. Now, using these aggregations, also we can weight them using, for example, all workers, low income, etc. Now, using these aggregations, we can also compare between counties, how they're performing, how maybe counties within the ARC are performing, how, let's say, urban versus rural counties are performing, or how economically distressed counties are performing. All of these metrics can greatly help in answering where funds are most needed. Now, although this data set is very rich in itself, more open source data can mean more such metrics. Eric, back to you to wrap us up.
Thank you, Soumya. I'm going to, in the interest of time, just dump some links into the chat. And what I'm going to be linking to are the publications that these presentations have been based on. So we share the data that we've used to create these reports, as well as the reports themselves on our website, and that's where these links are coming to. I want to emphasize that the data are available at that finest scale, the block level, and you can sort of have at them if you're interested in doing research or further analysis. We also, again, are always interested in hearing from people about other projects that they'd like to undertake in this vein using the Accessibility Observatory methods and data. So I think with all that, I'll just say thank you again to SSTI and thanks to all of you for participating. And I know we're short, but if there are questions, I'd love to try to answer them.
Thanks, Eric. And thanks to our other speakers, some great talks today. We just have a couple of minutes, but I think we can maybe extend for a couple of questions. I'll encourage the presenters to turn their cameras back on. And I don't know if we've lost Meredith already, but there is a question for her if she wants to take a minute or two about the post-processing methodology. And if not, I think she's offered to connect offline.
No, yeah, I am here. Emma, I'm familiar with Emma, and so I will happily go into in-depth offline with Emma, but unfortunately I do have a hard stop at the top of the hour. What I will say is the ability to assess change over time with the bus only lane that is tracked by our Maryland Transit Administration, and just the timeliness and consistency of the buses that run through that corridor. That is a very heavily run, I can think of at least 6 dedicated bus lines that run through that corridor. So we're able to track their consistency over time. And it's dramatically different than when they didn't have their own bus only lane. Then the bicycle facilities, it's the first instance of us using a bicycle traffic signal in, I think, the state of Maryland. Could be wrong about that, but at least in Baltimore City. And so, we really went all out on the bicycle dedicated facilities. And so there's a couple of different ways you can measure that. You can measure it by incidences, change in incidences over time. We certainly hope there are no fatalities and serious injuries, but you can certainly measure that over time. You can measure just sheer bicycle counts in a dedicated facility, and we have pre and post counts. And then there's other things. So what I will say is, when you add those facilities, there is a chance that pass through for vehicles might slow down. This is a trade-off that we're okay with, because this is a residential corridor with a lot of moving parts and commercial commercial establishments as well. And so if slow down means safer, that is a decision you have to make, but one that we made certainly in that corridor for safety and mobility and access of those residents. So with that, I do have to apologize. I have to go, but Emma knows how to find me, and anyone else is also welcome to reach out, and I will share what we learn.
Thanks, Meredith, and thanks so much
Thanks,
for
everyone.
participating. I think we'll go over just a couple minutes because there are a question or two here for Accessibility Observatory that might be interesting. The first one is non-work accessibility is somewhat new for Accessibility Observatory, and you've selected a few points of interest or destination classes to use in your metrics. Can you take us through the decision process there? Why some and not others? And also, what's your data source if you're willing to share? I know you're focusing on open source data sources.
Yeah, I can take that one. So there were a few different things that went into deciding what data sources and what destinations we were finalizing on. The very first was what ARC had asked us to do. And that included the larger buckets that you saw within that slide. But also, like I said, we wanted to be transparent. We wanted something that was easy to replicate. So we wanted to work with open source data sets. Everything that we did finalize on, we got nationwide consistent points of interests, and they are national sources. So it was easy to verify that they were correct, easy to work with in the next few years. So those were the two main or three main reasons why we chose what we did. For sources, we work with Loads LEHD for jobs. US Department of Homeland Security has a lot of these destination data sets. They have it for airports, for major sports venues, convention centers. Now, NCES is our education source. They have private schools, public schools, K through 12, as well as universities and colleges. I don't know if I'm missing something. I think
Healthcare.
those were, oh, healthcare. Yeah. So for healthcare, thanks, Eric. We're using CMS approved facilities. So these are facilities, primary care clinics. So they're called HQFCs and rural health clinics. They accept Medicaid and Medicare. So they offer care to anyone irrespective of their insurance. And that's also available from Center for Medicaid and Medicare.
Well, that's great. Those are.
Yeah, I was just going to add the missing destinations in this list. The obvious ones are things like groceries or daycares. Things that come up in what is our access to our daily needs. And what Samia was describing was the things that have some kind of federal interest or regulation end up having really good, consistent data sets across the country that we can use. And things like groceries and daycares, which are either not regulated or regulated state to state and county to county in many different ways, becomes a lot more challenging to easily assemble national scale data sets from. So that's, there are various solutions to that problem, and we'll definitely keep working on it. But that's like one consistent thing is if we want to have sort of nationally coherent data, we end up having to look for nationally regulated, homogenized type destinations.
That's great information. It's encouraging to see the use of open source points of interest because the commercial sources for that information are kind of they can be out of reach to some practitioners. So it's nice to see some progress along those lines. Let's just run one more question. You talked about reduced drivership. But at the same time, we're not really seeing that reflected in VMT. We're seeing increasing VMT, vehicle miles traveled, trips potentially spread out during the day. Have you thought about ways to account for the drop in morning traffic congestion? Maybe focusing on evening commute or by measuring access from jobs to home locations?
Yeah, the short answer is yes. And we do calculate access across the day. In the case of auto, we have the data and we do those calculations. So our reporting has been on the AM peak because it, corresponded so strongly with travel behavior before March 2020. So in the name of like consistency over time, we are, kind of still reporting on that 8 a.m. But you are right that the travel behavior has become more spread out, and accessibility might be more variable at different times of the day. So at noon or at 5 p.m. as you suggested. So as especially we incorporate these other destination types or, kind of different points of interest types, we're also going to be expanding how we think about that time of day travel and trying to synthesize that. Of course, you're just, sort of adding dimensions. So if you're summarizing across the whole day, like kind of how do you average that, or how do you decide what is really capturing the opportunity, becomes a different sort of aggregation problem. But it's definitely top of mind as we look at how people are using the system.
Great. Well, let's call that a wrap. Thanks so much to our presenters today, Eric Lind, Samia Jain, and Meredith Hill, and the SSTI staff members, Megan Link and Chris McCahill, working hard behind the scenes to keep this thing rolling. Keep a lookout for future SSTI webinars, and we'll see you next time.